Good afternoon, everyone. Salam alaikum. My name is Louisa Baldini. I'm a former BBC correspondent, and I'm delighted to be here leading this discussion on the launch of the Pain Management Manual. And we're joined by two of the co-authors, Dr. Paul Reevely and Emma Fisher. I'll be introducing them properly in just a few minutes' time. But just to say that if you would like translation, please do make sure that you have grabbed a headset from just outside the room. We want you to be able to listen to everything. So if you haven't got your headset and would like to grab one now, please do, and we will get going right away. I think we can all agree that seeing anyone in pain is really upsetting, but seeing a child in pain is really hard to bear. So especially when access to hospital care is limited, reducing pain perception, improving physical and emotional comfort for children is absolutely key. And this new manual aims to do just that. It's called Emergency Pain Management for Injured Children, officially being launched here at WISH 2024. And what it does is it provides family members, caregivers, first responders, and doctors with end-to-end practical guidance to treat trauma pain in children. It's been produced in collaboration with expert pain researchers and pediatric clinicians using evidence-based research within the field of pediatric pain management. And as I said, we're very lucky to be joined by two of the co-authors. Firstly, we have Emma Fisher, who's Senior Research Fellow at the Centre for Pain Research at the University of Bath in the UK. Welcome, Emma. And also Dr. Paul Reevely, who also edited the manual. And Dr. Reevely is a paediatric emergency medicine consultant at Bristol Royal Hospital in the UK. And Paul is also the co-founder and chair of the Pediatric Blast Injury Partnership, which you may be aware of. We will be taking questions after this discussion. It is quite a short session, so please do keep your questions short, to the point, and please let us know who you would like to direct those questions to when the time comes. But for now, delighted to lead this discussion and really wanted to ask you first, Paul. This manual stems from the previously published Pediatric Blast Injury Field Manual. Why did you decide that the pain manual was the topic within that you wanted to really focus on for this new guide?
Thank you very much, and thank you, WISH, for having us today. I think that the short answer to that is that as a clinician, I probably slightly fell short on the original task with the BLAST manual, that we under-recognise the importance of how we treat pain. And every injured child will be in pain. And everyone experiences pain. So in the same way that we wanted to build confidence for those treating children and allow them to have the tools to successfully treat pain, as a basic fundamental part of trauma management, the relief of distress and the benefits that brings, we wanted to focus on that element. Emma will tell you that as clinicians we are terrible at assessing and treating and providing for it and recognising its importance. So it seemed very important to us that we focus on that aspect of the manual and not just the stuff that we think is important, like the surgery and the resuscitation, which obviously is, but recognising a really fundamental aspect of trauma management.
And Emma, what in your experience is lacking in our fundamental understanding of the treatment and management of pain?
Yeah, there's so much, and I think there's a big difference between what we do in Western countries such as the US and Europe and Australia, and then what we know about low and middle income countries. So I guess what we know how to assess it, we know how to manage it, we know how to treat pain. But there's a systematic under-recognition of pain in children. globally. So even though we know how to do it, we don't necessarily always assess pain and manage it in the way that it should be done. So, I mean, you can take something as simple as a vaccination in a child. We know it hurts children. We know that children become very afraid of needles throughout their childhood. But we don't, and we have the tools to be able to treat that, but we don't always do it. And we know that within, the UK, as a mother, I've taken my children for vaccinations, and you kind of get condemned by nurses sometimes for doing it in an appropriate and a helpful way for that child. You take that context and you put it within a low and a middle income country, and there aren't necessarily the resources or the knowledge or the understanding, and there's a lack of research to understand how culture, religion, and kind of power dynamics within that hospital setting might influence that child's pain. So there's a lot to be done.
And Paul, you mentioned the word confidence. How much is it about confidence, in particular, when treating children?
It's vital. So we are traditionally taught as clinicians to find children difficult. The challenges, the difficulties and our failures are emphasised in the way we are taught and trained. And that's because we're taught to not respect, but be fearful of a negative outcome, which is a powerful motivator. But in the same way, for the BLAST manual, we know that actually, if you're an injured child today anywhere in the world, and that could be in the UK or in Gaza or in Ukraine, the person who will meet you to treat you is not going to be, or very unlikely to be, a pediatric trauma specialist or pain specialist, which is even rarer. Now, we know that they are developing, unfortunately, terrific expertise in both those aspects in conflict zones around the world. But the philosophy as a group that we have is to provide people the tools and the confidence to get over that. Our biggest barrier as clinicians in treating trauma and pain is not doing it for fear of getting it wrong. So we need to change that mindset, put something into their hands that says, you can do it, in fact you must do it, and this is how you do it.
You say putting something into their hands, that's part of the thinking behind these manuals, to really give caregivers and clinicians and doctors some support and something to be able to refer to. How realistic is it that, especially in a conflict zone, manuals like this, and with your experience with the Pediatric Blast Injury Field Manual, how realistic is it that people will be able to actually read and absorb the information when they're just trying to survive?
Well, I mean, being honest, now is not the time to try and train people in Gaza, is it? Because it's not appropriate. They don't, for example, the mindset, the mind space, all of the things aren't there. I can tell you this, though, clinicians love a book in their pocket. It's a real emotional crutch. And that in itself, its availability gives you confidence. But having this manual is, if it was in Gaza or Ukraine or wherever, or any conflict zone 6 months before it was needed, it's about building the resilience that you need as a system to be able to succeed when you need it. But having said that, teasing out aspects of that book. So if you are treating a child and you have access to a drug for pain relief, and all around you are lots of other injured children, that is the point at which you flip open or take that poster or take that card from that manual and look at that dose to give a safe dose. And doctors around the world in every setting will take that moment to access a book, an app, a policy, and say, this child is 10 kilos, I know how much to give them, I'm acting in a safe and successful way.
So you want it to be a really good reference, and do you have evidence that with the manuals you've already published that those are used in reference, especially in conflict zones?
I mean, it is very difficult to get feedback from these areas, and I'm sure Emma's going to talk about research at some point and accessing the information that we need. The timelines of knowledge translation are years in medical sort of fields. So this manual's been around for a few months. It has got into the hands of medics in places like Gaza. It has been distributed to at a higher level in places like the ICRC. But in this, exactly the same as the BLAST manual, we will in time get anecdotal feedback when opportunity arises. So I'm confident that it has helped some people. And like I always said about the BLAST manual, if it has helped 1 to 10 children, that would be sufficient justification for me.
And before I come to you, Emma, just Paul wanted to ask then, how are you actually getting the manuals out there where they're needed?
So at the moment they've been sent, I guess you would say informally, so they're not printed yet. And it's important to raise that this has been done on practically no budget when you look at this kind of development. And we need to secure that kind of budget and distribution network. We do have partnership with Save the Children, who have access into these areas to distribute things. So we've got the BLAST manual in there, which has a pain section. But at the moment,
sorry to interrupt, but how exactly are they distributing them then if it's not published in paper form?
so it's digital. So WhatsApp, there's a very successful WhatsApp network between clinicians, Gazan clinicians in Qatar, communicating with Gazan clinicians in Gaza. And that's a relatively secure, not secure, but reliable way of spreading information.
And Emma, the reality is in conflict zones there are scarce resources. I mean, in some cases, no medication. So how do you help a child, let alone an adult, who is in pain in those situations?
Yeah, it's a great question. So, like I say, we know a lot about how to manage pain for these children, and what this pain manual does is take a biological, psychological, and social approach to managing pain in children. Now, traditionally or historically, we thought we used a very biomedical model, so the more severe the injury was, the more pain we assumed that child had. We now know that many different psychological and social factors will influence that child's pain, so how the parents are reacting and behaving around them, their own experience of previously painful events, their own anxiety and fear. And we know as psychologists how to manage those influences of pain. So we can deliver things like cognitive behavioral therapy, we can distract children, even the way that you communicate with a child around pain, always being honest about that pain and never lying, never saying this isn't going to hurt. It's so important not to lie to children when they have pain. And so we've built this all into the manual, giving practical advice, not only how your dosing tables and which drugs to give in which situation and what surgery to do, but also how to interact with the child, how to communicate, and then how to use those really practical psychosocial skills to help manage the pain in the moment. Not only for the nurses and the doctors, but also we're writing scripts around distraction for family or caregivers to give in that situation. So often parents feel helpless when their children feel pain, and that's totally understandable. So giving them a resource that they can read through and they know how to hold the child, how to communicate with them, how to prepare them better is going to be so invaluable in these situations where there is such low resources to empower the parent or the caregiver to help manage that child's pain.
And to your point about this also being aimed at families and caregivers as well as clinicians, similar to what I asked Paul actually, how confident are you that a manual like this is going to be absorbed and read by families when they're just struggling to survive day to day?
Yeah. You know, it's hard to know right now because we need more research in this area. But I would say that if you gave a parent or a caregiver a distraction script or a relaxation script and empowered them to be able to do that with their child in the moment that child is having something painful happen to them, then they can use that. It doesn't take long to learn these skills. They can use that next time that child experiences pain. They're not always going to have to hold this manual in their hand. It's about giving them the principles of how to manage pain, how to communicate about pain to these children, to empower them for future events and for other children, and to then spread that message to their friends, family, loved ones.
Thanks, Emma. Paul?
I just wanted to add to that. I mean, one of the things that we have successfully managed to do for Gaza is produce some videos for lay, for non-medical trained people. And although we haven't done that yet, one of the next things we've got funding for is to produce similar kind of resources for pain training. That's the sort of thing that you can spread very easily through social media networks, YouTube, WhatsApp around. You can have a 5-minute video that could be aimed at anyone to say, when you have an injured or distressed child, these are the things that you can do, which will improve their pain, relieve their distress, and help prevent some of the negative outcomes of untreated pain.
Paul, thank you very much indeed. Well, we would love to take some questions from you, the audience. So apparently you need to use the app if possible. Hopefully you'll already be well versed in how to submit questions via the app. But it's a small enough room that we can also maybe take some questions here in the room. So either use the app or we can take some questions in the room. If you could please make your questions to the point and let us know who you would like to direct your question to, that would be fantastic. So we have a lady here in the front row. We've got a mic making its way to you. Thank you very much. If you could tell us who you are and where you're from first, please.
Thank you. Great to be here. I'm Alison Griffin. I work for Save the Children, so really pleased that Save is part of this project. An amazing resource. Spoke to a nurse who came back from Gaza who had to treat children with just paracetamol whilst dressing the wounds of their amputated legs. And so some of the stuff that she learnt on visualization techniques has gone into this. Sorry, that's not very to the point. But my question is, can you give us a bit more of an example about how, I guess just to Emma, what are the long-term impacts of this lack of pain, treatment around pain at critical levels in conflict, and what can we think about the future?
Yeah, that's a really good question. So pain that's poorly managed during the acute phase, we know has both short and long-term consequences for a child. So in the short term, they will just experience very high levels of pain, very high levels of distress. They will experience high levels of fear towards their next painful procedure. But long-term, there's been a lot of research that's been done looking at that transition between acute and chronic pain. And we know from that research that children that have poorly managed pain during that recovery period are much more likely to go on to develop chronic pain. And when I'm talking about chronic pain, I'm talking about pain lasting for longer than 3 months after the point of healing. And chronic pain, there's been a lot of research that's been done in that area, and we know that children who have chronic pain have higher or lower levels of mental health, so they're much more likely to be depressed and anxious. They don't act physically as their peers would, so they're not engaging with sport and their usual physical activities. And socially, they have fewer friends, they don't attend school, so they're not achieving those academic attainments that we would expect them to. So it really does have, from the point of injury, if you mismanage or under-treat pain, it can have a long impact on that child, and that can really impact everything into adulthood and beyond, because we know the burden of chronic pain in adulthood is also huge and is one of the biggest contributors to loss of productivity within economies.
In the initial treatment phase as well, untreated pain leads to increased bleeding, low survival, poorer wound healing. They just have a negative outcome in nearly everything. And 40% of children, I think this probably comes from one of your reports actually, 40% of children who are injured in conflict don't return to education. Part of that is the functional outcome of injury, and part of that is chronic pain.
I hope that answered your question. Thank you very much, and great to have Save the Children with us here, given that you are helping distribute this manual. Thank you so much. Any more questions for the audience? Be very happy to take them. I might have a slight technical problem with receiving your questions on the app, so if you have written a question on the app, it would be great if you wouldn't mind posing it in the room as well verbally. But yes, we have a question from a young woman here, please, if you could tell us who you are, where you're from.
So, hello. Is it working?
Yes.
Yes. Hi. My name is Reem Al-Janahi. I'm a fourth-year medical student here at Weill Cornell Medicine, Qatar. I submitted this on the chat, but just in case.
Thank you.
Are there any plans for this manual to be translated into different languages and or expanded to include different cultural perspectives and backgrounds?
Yes, there is. So we are hoping to translate it firstly into Arabic. And that will be our first step. We've successfully translated our previous work into 7 or 8 languages, including Ukrainian, French, and Chinese. So some now into Turkish. So we hopefully follow that. And answer to the question about the cultural is a really interesting question actually, because I think, yes, we have a follow-on piece of work which will be much more comprehensive. And I think in that we will delve into some of the cultural aspects. It's a really difficult area to address because the the way in which we express pain, I think we're not even certain that we've established what different cultures do. And there's been some really interesting anecdote from Gaza about how children have changed the way they express their pain in response to wanting to appear to be brave, not wanting to be part of the problem. So we have to work out what our assumptions are, and this is where Emma comes in with her research, of course. But yeah, I think culturally we can certainly adapt or focus on appreciating how important it is to recognize pain and not make assumptions about how we think people express it.
Yeah, just to add to that, you know, we're hoping that this is a one-stop manual. So we're not going to write different manuals for different cultures, but I think it's critical that we recognise the influence that culture plays. And like Paul says, we don't know enough about that outside of kind of the Western countries where most of this research is done, and it's not been researched even that much within those cultures. So it's about recognising that it's important, but actually the people using these manuals will be much more familiar with that than what we could ever be.
Thank you very much. Question from the gentleman in the front row here, please. Thank you very much.
Thank you. Paul, this is not your first time to Doha. You mentioned we a lot when you talked about some of the translations. I wondered if you could perhaps give those who don't know you and this work so well a bit of an overview as to the role that WISH and organisations here in Qatar have played around supporting this initiative and the ones that have before it.
And before, Paul, you launch into your answer, just where are you from, please,
Sorry,
sir?
from the Halo Trust.
Halo Trust, thank you very much.
Thanks, James. You know the history well of this manual. It was initially quite a small project, or rather the original work. The BLAST manual was a small project that was designed for one context in Syria only. This is my 5th trip to Doha, which is very happy to say. I would never have been to Doha if it hadn't been not for WISH, who took the project to its next stage, which was translating it initially into Arabic. And they have maintained a very regular interest and support, and particularly Sultana, who I think is sitting here. Great to see you. And has basically kept us motivated and kept the foot on the accelerator to keep going. So without WISH, we wouldn't have translated the BLAST manual into most of its languages except one. And without WISH, we would not be driving this, this initial piece of pain work and the subsequent work. So it's entirely with them and, of course, QF that we've been able to do this. They've been the sort of funding side of it. And as you know, the partnership has got various aspects, and WISH have been critical there.
Thank you very much for that question from the Halo Trust. Question from the gentleman halfway down, 3/4 of the way down.
Thank you for your initiative. I was just how to access this manual. Is it available on which website?
Do you know what? I did actually have a QR code that I thought might end up on the screen, but perhaps it hasn't. It is available, not through the WISH website. It is available through the Imperial website. I wonder how we can do that today easily. Sorry.
If you Google it, you can find it.
I could put my phone here with a QR code on it at the end of this talk, and you can come and scan it.
Okay. I will do.
Thank you,
but
sir.
if you search Pediatric Blast Injury Partnership, there we go. Fantastic. That'll save me a lot of work.
Okay.
Thank you.
Great. Isn't technology great when it works? Fantastic.
Okay.
Good, but really good question and good point, and it goes to show, doesn't it? It needs to be really easy to access and to find, doesn't it?
Absolutely, and it's amazing how powerful the sort of natural spread of things are, but we have always relied on people saying, oh, this looks useful, this looks good, and sending it to their friends, basically. So scan that and send it to your friends. If you go to that QR code, the pain manual comes up, and then underneath that will be a link to the blast injury manual in its various languages, which will take you to another website. So please use it. It's free, and we are very happy for people to take bits out, adapt, use for your own purpose, and please, if you can, get an opportunity to feed back to us what you think and what needs done next.
Are you targeting the healthcare provider or also the family members?
Targeting who?
Healthcare providers.
Healthcare provider. Yeah.
I mean both, but I think it's hard to do that within one book. But the principles, the psychosocial principles that we apply, and some of the non-pharmacological ones could be used for both.
Yeah.
I think, in honesty, we're looking at healthcare workers as the first line of organised pain relief, but that goes all the way down to first responders, which is practically lay response.
I mean the family, they play a role in the pain management, non-pharmacological pain management, more than the healthcare provider.
Sorry, Emma, you can answer this one.
Yes.
So the manual is written for the healthcare provider primarily, supporting them to deliver non-pharmacological or psychosocial strategies to the child. We really recognise that healthcare providers are under a lot of pressure within these contexts. So it's also written in a way that a parent could or a caregiver could pick up the manual and read those psychosocial strategies to help the child manage pain. But primarily we're focusing on the healthcare provider.
But we also encourage the healthcare provider to involve the family and ask them to participate in the pain package, if you like.
Yeah.
I think we've got time for one more question. Thank you, sir, for yours. We've got a lady in the front row here. Thank you.
Thank you so much. I'm going to make it short. Just to introduce myself, I'm a full professor of pediatric and family nursing with history of working long time in the University of Jordan in Jordan, and I just recently joined the Qatar University as a faculty also. I have done much research or many published studies about pain management in children, and I started with the same interest when I saw the practice of pediatric pain is more a little bit responded to in the West, but not in our country. So I started my research trajectory in that area. My question is about the training, because we are talking about the issue of translating that document into practice. So I haven't seen the document. Does it need a lot of training? Are you interested in doing that training? And what about countries outside the war zones and the conflict areas, like neighboring countries, like I'm thinking about Jordan, I'm thinking about also Syria, Lebanon, maybe the Gulf area surrounding these areas. We don't know what will happen. I hope peace will finally reach the land of peace one day. But what about the training? Does it need a lot of training? Do we need to have trainers to train about these documents? I know that you have translated it to Arabic, but translation is something and cultural adaptation is something else. When you talk about culturally adapting this manual to the practice of people, because I have been challenged with that when I wanted to translate my studies and do the workshops. I'm more interested in neonatal nursing and pediatric nursing somehow,
Thank you very much for the question. Who would like to answer that?
Okay. So does it need a lot of training? I think the manual that we have at the moment, the answer to that is probably no, but it certainly improves its worth by having some training. But if you as a clinician picked up that manual, if you were an adult emergency physician, for example, it would make perfect sense to you. And I think you would be able to apply that without any further training. Do we want to do some training? Yes, we do. And I certainly will be beholden to providing some of that as part of our next work. Would I like to do it in Jordan or any other neighbouring country? 100%. I mentioned before about building resilience. Hopefully this is not just going to be used in conflict. And like the blast injury manual, the great secret is it's a pain manual that you could apply to any injured child. If they fell over in a park in London tomorrow, you could use it. And if you broke your leg on a skateboard in Washington, then you could use the injury manual. So we hopefully in the next few months will provide probably online training packages that people can access. And that can be accessed in places where it's not yet needed, or it's not needed in the conflict aspect.
Do we need permission to use the
No,
manual?
you can have it. It's yours.
No permission
It's
needed.
open access.
I mean, if you want to
the
email
manual.
me and say you're using it, then I can wave that to someone and say, give me some more money. That'd be brilliant. But,
Very good point. Thank you very much for your question, madam. So it is time, unfortunately, that we are going to have to bring this to a close. But I just wanted to thank you very much for your questions here in the audience, and thank you very much to Dr. Paul Reevely and Emma Fisher. Please do download that manual, spread it wide and far, share it with all your contacts if you can. And just to conclude, you know, obviously that manual you are hoping is going to be, as you said, a really good reference point. At the same time, what I noticed in that manual is an acknowledgement that in an ideal world, not all those references and good practices are going to be able to be followed. And what struck me was reading this in low resource, that's the timer for the end, sorry. In low resource and conflict settings, the prioritization and capacity to manage pain may be extremely challenging. This guide, it says, will give the caregiver a toolbox to select what may be available and achievable at the time. Do what you can. Thank you very much, everyone.